Something to think about on this April 1st. No fooling, it is Oral Health Care Month. Pediatric dentist Dr. Ian McConnachie is here. How are you?
I'm very well, Kurt.
I know you're very excited because Michigan's in the Final Four and you're a Michigan alumni.
I'm a Michigan alumni, and I'm very excited that Morning Live has decided for April Fools they bring a dentist in after Easter chocolate.
Isn't that funny?
It's perfect.
Who came up with Oral Health Month starting in April 1st? Some joker of a dentist. Hey? You're a pediatric dentist, so this obviously we want to target young people and families and that sort of thing, because a lot of people, especially first-time parents and so on, have questions about when to bring a child to a dentist and so on. Right. You have all the answers to that.
Sure. Oh, really?
Because you've been a pediatric dentist for a long time now.
A long time. I graduated from Michigan in 1980, so I've been around Ottawa since 1980.
Right.
The main goal at Ontario Dental Association this year for Oral Health Month, we're aiming at getting the message out about the appropriateness of getting in for regular checkups. Right. And not just for kids, but for the entire. No matter what your age. No matter what, yeah. Because the mouth is the gateway to the body, and very often people, hardworking, behind schedule, whatever, they put off these checkups, and then the consequences of the delay can be significant. Yeah, because sooner rather than later you're going to run into major problems. Major problems, but also the whole evolution of dentistry over the last 10 to 20 years has been huge advances in the understanding of the various diseases of the mouth and understanding of the oral health, general health connection. So we understand as well the value of the early intervention, the early diagnosis, because it's totally changed. In the old days, basically you saw the disease, you treat the disease. Nowadays you catch it early in its process, you can reverse the disease process. That's true of both decay, gum disease, and a lot of the other systemic things that we can pick up. You mentioned the connection between oral health and general health. Yeah. What kind of things are we talking about that's connected to the diseases of the mouth and so on? There's several things. The mouth sometimes shows indicators of things happening elsewhere in the body. Right. So that, and they're non-specific. So we see problems with the gums that don't seem to fit according to what we're seeing in terms of local conditions. And then you're starting to think, and because the dentist has that good understanding of general health concepts and understanding of diagnostic skills, we can pick things up and say, okay, we need further evaluation. Right. And you're always, as a professional, as a clinician, when you pick up these things, you're justifiably proud that you've been able to make the connection and then get people to appropriate care. Right, right. And then in terms of oral diseases, I mean, the classic connections, oral health and general health. Diabetes is the main one where we see a lot of changes in the mouth that we can be picking up often before it's actually been diagnosed, and then sending people down the road for the appropriate testing. Heart disease is the other one, where there's linkages that things that are happening in the mouth can have a negative impact with respect to heart disease. Right. And vice versa. The heart disease can show oral problems as well. Exactly. So there are some identifiable factors on both ends. Right, right. Yeah. We relayed a story on the Ontario Dental Association website, youroralhealth.ca, about Linda, who, typical parent, busy life, delayed getting in for checkups, and then she gets to the dentist finally, and something is identified that ends up being some significant surgical care to get her back onto a level of health. So it's worthwhile remembering, both for localized diseases as well as for the systemic. You need to be in at a regular interval to make sure that you're on top of things. No matter what your age. And you mentioned a website. Where can people get more information? Youroralhealth.ca. We've also got a great magazine. I see that, yeah. And this is full of tips, full of nice little stories, interesting things that are of value on pregnant moms, on teen smoking. Right. You can see it on the website. You can download it as a PDF as well. Very good. And I'll leave it for you for leisure reading time. I shall have a look at that, as a matter of fact. Dr. Ian McConnachie is a pediatric dentist. Thanks for your time today. My pleasure, Kurt. It is Oral Health Care Month. I know it's April 1st, but it's all month long. It's not just today.